Thank you. Such a wonderful message.
The launch of the survey report that was conducted between June 2018 and February 2019 across all the 47 counties now indicates that the burden of HIV remains and is still a problem, especially among women compared to their male counterparts, a disparity that has been attributed to health-seeking behavior among the two genders.
The prevalence of HIV in women is at 6.6%, twice that in men at 3.1%. This gender disparity in the burden of HIV is even greater than 3 times in between the ages of 20 to 34 years. This data shows the ever-widening gap from the 2007 to 2012 KAIS surveys that are now showing a significantly higher burden of the disease in women compared to men.
We have a challenge, especially among men, and I think the men in terms of their behavior of accessing healthcare is an issue. Women, why we have more of their data, remember, because of the fact of the ANC, pregnant mothers or breastfeeding, it's mandatory for them to be done to do the HIV test, but it's voluntary as well. They can opt out. But that's why at least we have that data.
Speaking during the launch, Health Chief Administrative Secretary Dr. Rashid Aman says progress has been made in stemming the rate of new HIV infections in the country since 2012. However, of more concern now is the increase in the number of people being diagnosed with HIV in the counties of Turkana and Kisii.
More attention needs to be paid to the counties that have an emerging epidemic, as evidenced by the consistent rise in the HIV burden. Among these are the counties of Turkana at 6.8% and Kisii at 6.1% prevalence.
According to the report, approximately 1.3 million adults between the age of 15 and 64 years are currently living with HIV in the country. Among these, 80% are aware of their status. 96% of those aware of their status are on antiretroviral therapy or ARVs. 91% of those already on treatment having attained viral load suppression as per the UNAIDS 90-90-90 global target. According to the report, Homa Bay County tops the list of counties with high prevalence rate more than 9% at 19.6%, followed closely by Kisumu at 17.5%, Siaya at 15.3%, Migori at 13.6%, then Busia at 9.9%.
There are several factors which will bring the counties having the higher prevalence. But right now, we could say it's because people are living longer. And I think when you go to several cohorts in the counties, you will notice that we are having 50 to 64, a high percentage of both male and female.
Counties with the lowest prevalence rate include Samburu, Tana River, Garissa, Wajir, among others. Meanwhile, the report says when it comes to viral load suppression, men and children were lagging behind due to poor health-seeking behavior and lack of formulations that are child-friendly, respectively. Gloria Milimu, K24 TV.